I'm Dr. Pradeep F. Das. I'm a general practitioner based in the United Kingdom. Today I would like to do a short presentation on the macrovascular complications of diabetes. Before I go on to describe what diabetes is and what are the potential complications that it could cause, I would like to briefly highlight the impact diabetes has on the 21st century. As of now, we know that there are 425 million diabetics around the world, which means that 1 in every 11th adult could be a diabetic. We also know that 1 in 2 of the diabetics remain undiagnosed. The strain it puts on the global expenditure is 12% of the global health expenditure is being spent on diabetes and related conditions. 3/4 of all diabetics are in the working age group. 3/4 of all diabetics live in the low and middle income countries. We also live in an era where sugar is more powerful than the gunpowder. In 2012, there were 56 million deaths worldwide, of which there were 620,000 deaths due to human violence, whereas diabetes attributed to 1.5 million deaths around the world. Diabetes is a long-term condition in which the blood sugar levels, that is the glucose, remain consistently high. When we eat food, it goes down into the stomach where it is being broken down into smaller particles by enzymes, and it is a chemical present in the stomach. These particles are called nutrients, and glucose is one such nutrient and is the main fuel of the body. Glucose is either used by the body to function or stored for functioning later. The level of glucose in the bloodstream is regulated by a chemical called insulin. Insulin is a hormone which is produced by a gland called pancreas, and it sits right underneath the stomach here. The body produces insulin according to its needs, and if by any chance the insulin produced by the pancreas is either inadequate or ineffective, the blood glucose levels tend to raise and remain elevated. This condition is called diabetes. Diabetes can be diagnosed with blood tests. There are several blood tests that is available for diagnosing diabetes, of which blood glucose levels are the most common one. Blood glucose levels are readily available and is relatively inexpensive. The next most common one is HbA1c, which in comparison to the blood glucose levels are slightly expensive, but it gives you the average of your blood glucose levels for the last 3 months. This is a table that shows the blood test and the cutoff values. Diabetes is diagnosed when the fasting blood glucose is above 7 millimoles per liter, or if it is above 11.1 after 2 hours of food, or if it is above 48 of HbA1c. You might have noticed that there is a pre-diabetic state here. In these individuals, the blood glucose levels are not high enough to be classified as diabetics, and neither is it low enough to be normal. These individuals stand at a higher chance of being diabetic in the future. It is just a matter of time. In individuals whom the pancreas doesn't produce any insulin, they are classified as type 1 diabetics. These are often seen in children or very young adults. The presentation is often very dramatic: sudden loss of weight, increased thirst, increased frequency of passing urine. Most often they might collapse and end up in hospital, and the diagnosis is usually made there. In individuals in which the body doesn't produce adequate amount of insulin, or the insulin produced is ineffective, are classified as type 2 diabetics. They're often seen in adults and seen in associated with family and in obese individuals. We know that if one of the parent is diabetic, there is a 15% chance of inheritance of the risk, and if two of the parents are diabetic, there is a chance of 75% of inheritance of type 2 diabetes. The symptoms of presentation can be tiredness, lethargy, increased frequency of passing urine, increased thirst. Women might have recurrent urinary tract infections and vaginal infections, recurrent skin infections, and in males, erectile dysfunction is another. There are other forms of diabetes as well, like diabetes in pregnancy, diabetes caused by illnesses, certain medications, and genetic conditions. But for the purpose of this presentation, type 1 diabetes and type 2 diabetes are the ones considered, and they form the majority as well. Diabetes not only makes an individual symptomatic, it can also damage other parts of the body. Such damages are called diabetic complications. Broadly speaking, we could classify diabetic complications into microvascular complications and macrovascular complications. As the name suggests, vascular means blood vessels. These are the tubes that carry the blood to the different parts of the body, and macro means big and micro means small. So when diabetes damages the big blood vessels, it is called the macrovascular complications, and when it damages the small blood vessels, it is called the microvascular complications. With microvascular complications, it can damage the eyes called retinopathy, it can damage the kidney called nephropathy, it can damage the nerves and it is called neuropathy. And when it damages the big blood vessels to the heart, it causes cardiovascular illnesses like heart disease or angina. And if it damages the blood vessels to the brain, it leads to stroke. And if it damages blood vessels to the extremities of the body, it causes peripheral vascular disease. There are several reasons why diabetics develop macrovascular disease. The most common reason is prolonged elevated blood glucose levels damage the inner lining of the blood vessels called the endothelium. This sets off a cascade of reactions which eventually results in a condition called atherosclerosis. Atherosclerosis is nothing but a plaque that is formed inside the blood vessels. These plaques are formed with fat cells which the body often seals it off. Occasionally, these plaques rupture and they migrate along the blood vessels, causing interruption of the blood flow. If it interrupts the blood flow to the heart, it causes angina or heart disease. If it interrupts the blood flow to the brain, it causes stroke. And if it interrupts the blood flow to the blood vessels of the limbs, it causes peripheral vascular disease. Conditions like this are accelerated by other conditions like a high blood pressure, smoking, hypercholesteremia or high cholesterol, and if there is a family history of macrovascular disease. Two-thirds of diabetics end up having macrovascular disease. Diabetics stand at 4 times higher risk of having a cardiovascular disease in the whole lifetime. If you compare a 65-year-old person with diabetes, they have 68% chance of having a heart disease or 16% chance of having a stroke when compared to a person who does not have diabetes. The best way to treat a macrovascular complication is to prevent it. If you're a diabetic and if you're smoking, please stop smoking. Lifestyle modifications with diet, exercises, and weight reduction would help both diabetes and the prevention of macrovascular complication. In a diabetic, optimal management of blood glucose levels can be done in partnership with your family physician. They might recommend medications, and it has to be taken regularly, and regular monitoring should be done. Optimal management of blood pressure, optimal management of cholesterol should also be done. Kindly note that the target values for blood pressure and cholesterol is much tighter in individuals with diabetes when compared to individuals without diabetic. If you're a pre-diabetic, start off with lifestyle modification and please do not wait for the diagnosis of diabetes. The summary of the presentation. Diabetes is considered a non-communicable epidemic of the modern 21st century. The macrovascular complications are common in diabetes. Approximately 2/3 of all diabetics end up with some form of macrovascular disease in their lifetime. These complications could be prevented or delayed. Lifestyle modification with diet, exercises, and weight reduction are important both in the management of diabetes and for the prevention of macrovascular disease. If you're a diabetic, it is extremely important that you stop smoking. Optimal management of diabetes, blood pressure, and cholesterol delays the onset of macrovascular disease. For the monitoring of these diseases, Regular follow-up with a family physician or a diabetic specialist is advisable. Hope you have enjoyed this video. Kindly find some links in the description section which has excellent information about diabetes and its complications. If you do have any questions or queries, please drop them in the comment section. I'm more than happy to answer them. Thank you very much for taking the time to watch this video.